Nigeria and get updates on the go all day, every day. Subscribe to our YouTube channel on TSL Nigeria Space TV and join our online family. To TSL Nigeria and get updates on the go all day, every day. Subscribe to our YouTube channel on TSL Nigeria Space TV and join our online family.
And we are back. This is still the breakfast show on TSL Nigeria TV. Today, we're going to be looking at the general scope of sickle cell anemia on today's edition of Healthy Living. Now, sickle cell anemia is one of the most diseases that is perceived as one of the most threatening disorders in the world. It is an inheritance anemia. This condition is the situation whereby there are not enough red blood cells in the body adequate enough to carry out oxygen throughout the body. Apparently, it is much more prevalent in blacks than in whites, and according to research, over 300,000 babies are born with this disorders, with approximately 5% of the world's population with this trait. This morning, we're going to be discussing with medical practitioner Dr. Karo Onoriose, and she will be talking to us on all that comes with sickle cell anemia and for you to get aware about it. You can also be part of the conversation. Drop all of your comments and your questions, and Dr. Karo will take you up on the breakfast show this morning. Good morning, Dr. Karo.
Good morning, Nikki.
I can't wait to be carried by you, Dr. Karo.
And you look really, really beautiful.
Oh, thank
for
you.
For a doctor.
What do you mean for a doctor? Doctors are beautiful. What do you mean?
Don't attack me.
I'm attacking you.
Don't attack me.
My future doctor babe I think he's ugly. Boo, you're cute.
Okay, so quickly going straight into the conversation of today, let us know about you first of all.
Okay, my full name is Dr. Karo Onoriose. I'm from Delta State. I graduated from the University of Benin as a medical doctor.
Amazing, amazing. So, what is sickle cell anemia? A lot of people are trying to say if you're SS, you're going to have sickle cell anemia, or you're going to come down with this particular disorder. And so I want you to clear up that. What is sickle cell anemia?
Okay, sickle cell anemia is basically a genetic disorder. It's genetic, and it's a genetic disorder that has to do with a mutation.
Okay.
When I mean mutation, I mean a change in the configuration of hemoglobin. Hemoglobin is the compound in your red blood cell,
okay,
that moves oxygen from one place to the other. Now, the normal adults, we have several types of hemoglobins. The normal adult hemoglobin is the hemoglobin A. Hemoglobin found in children that are yet to be born is hemoglobin F. But when there is a mutation, it becomes hemoglobin S, which is the most common, and then there are other types of mutation, but the most common and the most dangerous is hemoglobin S.
Wow.
So when somebody now has hemoglobin S, 2 hemoglobin S, or an hemoglobin S and another hemoglobin, and another abnormal hemoglobin, we say that person has sickle cell disease.
I've never been so terrified of alphabets before. We've seen a major issue that happens with people who have sickle cell anemia is hemoglobin deficiency and defects.
Yes.
Now, can it be treated in any way, shape, or form?
Because it's genetic. So when we say genetic, it's something that has to do with the gene, the very makeup of the person. Okay. That means it is lifelong.
All right.
So it can only be managed, but cannot be treated. Well, recently, if you do a bone marrow transplant, that means if you change the bone marrow where the blood is produced in the body, if you change that, yes, it can be treated. You can change the person's genotype. You are now changing the person's genotype from SS to AA.
But
wow, is it not really
procedure for cancer of the blood? It's the same procedure, right?
You're talking about leukemia.
Yes. Leukemia.
Well, yes, in a way, but for sickle cell anemia, leukemias, yes, basically yes. For leukemias, for sickle cell anemias, you can do a bone marrow transplant and it helps.
Okay, so talking about sickle cell anemia, and you said it is genetic. It's something that comes like when you are born.
Yeah.
If you have parents that are AS carriers, AS and AS, and you give birth to a child that is AS, is it possible that the third generation, could come down with sickle cell anemia if you're going to go genetically on this?
It's not hereditary in that sense.
Okay.
It's hereditary, but not in the sense you just put it. It doesn't mean, okay, if I didn't have it in the first generation, it's going to come in the second. It just depends on the parents in that generation, the parents of that particular child.
Yes.
For a child whose parents are AS, both parents are AS, they have a 25% chance of giving birth to a sickler, what we call sickler.
Okay.
Yes.
That's okay.
A 25% chance.
Okay.
That means,
But it happens so often.
yes.
They have 4 children.
That is no. That is not what it means. It means that for every child, there is a 25% chance that that child will be sickle cell anemia. It's different from what you are saying, because what you are saying is that if I have 4 children, I'm going to have 1.
So I can't cancel it out and say,
No, you can't cancel it out.
Okay.
It means that for every child, it means that you can have 4 children and they would all be patients of sickle cell disease.
I thought it would be a lot more scary. But anyways, a few days ago, about a week ago, the CNN released an article saying that in Africa, our relationships and our love lives is heavily dependent on our partner's genotype. Does this mean that it's not as prevalent in other places outside the African continent? Does it bedevil us in particular?
Yes, actually. In Africa, West Africa precisely, the prevalence of sickle cell and disease is as much as 30%. It's the highest in the world, and this has been related to the fact that this is also a malaria endemic region. Sickle cell disease has been strongly related to malaria because it has been found that the carrier form AS is more resistant to malaria.
That's true.
So the medical world has felt that the trait is a form of resistance against malaria. Where the problem now comes is when you now have both genes as hemoglobin S.
So sicklers are not so prone to malaria as AA?
No. Sicklers are very prone to malaria.
That's
well, yes, because of what goes on in the blood, it predisposes to a lot of things actually. So what I was trying to say is that if you have an AA child, you have an AS child and an SS child. The SS child rather is more likely to have a less severe form of malaria than an AA child. An SS child, you don't even want him to have malaria. Wow. You don't want him to have malaria.
I can imagine.
But for the why we got here is just talking about prevalence.
Yes.
It has been seen that because that is why it seems nature keeps allowing the gene in Africans.
Isn't nature allowing it, or we are the ones marrying each other?
Because they say it's much more prevalent in black than in white.
That would just be the explanation for the prevalence.
So I saw that environmental factors act as triggers to when they have these attacks, like cold, inhalation of tobacco, and several other things. So are there conditions that people that are living with this disorder should stay in to reduce how frequently they have these attacks?
Yes, to answer that question, I'll give a little bit of explanation as to how the disease state leads to the manifestation of the disease.
Okay.
Now, sickle cell, what it just means is that the hemoglobin in the blood becomes clumps together, let me put it that way, clumps together, and then it becomes solid. And then when it becomes solid, semi-solid towards solid, it destroys the cell membrane and causes the cell membrane to change its shape. Normally, the red blood cell is biconcave, let's say round.
Okay.
For more people to understand. It's let's say round, and the shape, it enables it to squeeze through the red blood cells. You know, red blood cells have different sizes and different organs, and then but when it becomes sickled, it's like
a sickle shape,
a sickle. It's not as mobile, and it's not easily passable in the red blood cells anymore. And then even most times get complicated. You know, there are sticky substances on it, so they clog together. Now, answering your questions, take cold for instance. In cold weather, your red blood cells are more likely to get. When you're cold, your blood vessel, the pipe now for the blood vessel, you understand, it's going to constrict. That is going to get smaller when you are cold.
Okay.
Now imagine just yes, usually. Usually. Okay. In cold weather, your blood vessels get smaller.
Okay.
Now, for somebody that is sickle cell and has a lot of sickle cells that can't move easily, that means now I can't move easily, I can't squeeze and pass like the normal red blood cell. I'm going to get stuck more because now the blood vessel is tighter.
Wow. Cry.
Yeah, so because the blood vessel is tighter, I'm stuck. Blood can't flow anymore. Now, what is blood? Blood is a medium for carrying. Oxygen is a medium for carrying. Glucose is a medium for carrying, and it's also a medium for removing wastes from the organs. Now, blood is not getting there, oxygen is not getting there, glucose is not getting there.
Wow.
Imagine you can't breathe, the organs can't breathe right now.
They pass out.
So they start dying. When they start dying, it results, we call it ischemia, and so it results in pain. Now, this is basically what causes most of the manifestation of sickle cell we call crisis.
Okay.
A very common crisis is vaso-occlusive crisis. Blood vessel, occlusion crisis. So like I explained, right now the blood vessel has gotten clogged, it's now blocked, and blood is not getting to the organs. So that organ starts being in pain, and then pain can occur anywhere, can occur in the legs, in the hands, anywhere. Pain can occur anywhere. So that's for cold. Cold does that.
Wow. In relation to that same question, is it possible for sickle cell patients to actually participate in athletic activities, exercises, like real complex ones? Is it going to cause them to have their crisis?
Okay. There is no limitation per se to exercise, but the question is, can you do this exercise? Remember, the blood carries oxygen. Oxygen and glucose, you understand? So when you are exerted, your requirement for oxygen and glucose is increased. Now, for patients for normal people, they are what we call PCV, packed cell volume, usually ranges for ladies at least. Ladies have lower, so ladies at least 37 but at least the worst case scenario, your PCV is 30. Now, for most sickle cell patients, their stable PCV may be as low as 24. Okay. The red blood cell, I should mention this, that the red blood cell for normal persons stays for as long as 3 months, 120 days. But for a patient with sickle cell disease, their red blood cells last for 10 to 20 days. So that makes the oxygen carrying capacity of that person's blood much lower. So we won't really say don't partake in physical activities. We won't say that, but can the patient partake in physical activities? And then if a sickle cell patient has to partake in physical activity, he has to be aware of his condition and be properly hydrated. I mean, drink a lot of water because it helps. Back to the question she asked, I was going to talk about dehydration. When a sickle cell anemia patient is dehydrated, it also predisposes to crisis. We are talking about things that predispose to crisis. It also predisposes to crisis because when you are dehydrated, that means that the blood is thicker. Okay. Relating it to the fact what we said earlier, like they can't easily squeeze. So now the blood is thicker because there's less water.
Okay, Dr. Karo, before you continue, let's just take some comments. We have Charles Osayamo. He says, "Good morning, ladies. It's great to join you on the breakfast show on TSL Nigeria TV." Thank you so much, Charles. Makinde Ayomi Christiana, she says, "Morning, ladies. This guest is so on point." And Makinde says, "I love TSL Nigeria. They're so unique with their guest selection and programs." Thank you so much, Makinde.
Okay, I think I mean my feelings from everything because I've seen some of them in crisis and just understanding what's going on inside their body, I feel really horrible. Now, research has shown that the bulk of sickle cell anemia carriers are going to die before the age of 5, and then they claim that if you pass 5, the chances of you surviving to old age is really high. Does that mean that the crisis is not as serious after 5, or your body is stronger after 5?
Okay, I won't agree with that research.
Okay.
I won't agree with that research. When a sickle cell anemic patient is well taken care of, and I think we really should talk about that.
Okay.
Yes, later on. Maybe, but
let's just talk about it.
Let me answer this question. We'll talk about that. When a sickle cell anemic patient is well taken care of, the chances that he's going to have a good life. Previously, when I was much younger, the patients I knew, they were retarded in growth. Okay. They had very big tummies. They always had yellow eyes, jaundice, and they didn't look good. But with recent knowledge in the field of medicine, we've seen children that if they don't tell you, you won't know. You won't know.
Very true.
Okay. You get. And we have also seen patients that are able to get married and give birth to children.
Yes. Wow.
Yes. Wow. It's possible. I've seen a lot of patients like that. And there are patients that live up to the age of 42, 48.
Wow.
With sickle cell anemia.
I mean, so how do we take care of this? How do we manage it if you're down? Because I think that a lot of people are not aware of the fact that this is not just going to kill you. You're not going to just die out. We can actually manage it. You can literally live longer. And so how do people watching out there manage this?
Okay. First of all, it starts with diagnosis. Being able to know that this child is suffering from sickle cell anemia. Okay. Because some patients up to now, some parents up to now don't even know their what's it called, their genotype. So they don't even know, okay, if they are, what problem the child has. So this is a general statement. When your child is ill, when you are ill, go to the hospital. Don't self-medicate. This is a general statement I'm putting out there. Okay. Okay. Then when it has been found that your child is anemic, or you are anemic, you need to have let me put it this way, you need to have a dedicated doctor treating you.
Okay.
Oh, why is that?
It is because your progress needs to be monitored. Yes, you need to keep a medical history at one point. So you don't, it's not I go to the hospital today, I go to the hospital today, I go to this. So you get a good a specialist, usually a pediatric hematologist, or for adults, and a hematologist that treats you and monitors your health. And then, so basically, that's it. Number one, have a
dedicated doctor.
Good. Okay. Follow up follow-up clinics are very important. Then 3, there are some, when your child is ill or you are ill, go to the hospital. Because there are some complications of sickle cell anemia that can kill instantly. So you want to go to the hospital. I'll mention some red signs. If you have fever greater than 38.3 degrees C, you want to go to the hospital to get checked up. If you are breathless, you have chest pain, difficulty in breathing, you want to go to the hospital immediately to get checked up. Okay. If you have headache, severe headache, you want to go to the hospital immediately to get checked.
Dr. Karo, just to hold you there, we have a question. Okay. Ayib Apebra, he says that can exercise play any role in sickle cell cases, that is to help the individual live longer?
I wouldn't. Well, exercises generally are advocated, good for you, but to say it plays a very, very decisive role in sickle cell anemia, I wouldn't say. I wouldn't.
You wouldn't say that, but so okay.
What you were saying before, so we can wrap up.
I actually just thought of something. Apart from the hereditary factor of transferring genes and all, is it possible for a sickle cell patient to transfer the trait, probably through blood transfusion?
No, that is not possible.
Can they even do blood transfusion to start with?
They don't even have enough blood.
Okay.
To give out.
Wow. Amazing. So this is where we'll have to wrap up. We would love you to go like on and on and on. We literally have seminars.
I'm so bad up.
We literally have seminars and we will not be exhausted.
I hope I did not just come and say about all the evil things about sickle cell anemia.
No.
Because, it's sad, and what makes it much more sad is because it is very, very preventable.
Okay.
You just do genetic counseling before marriage, and make sure you are not getting married to somebody that is not compatible.
Wow, amazing. With this, we've come to the end of another exciting episode of the Health Living on the Breakfast Show on TSL Nigeria TV. We are growing our YouTube channel, so do well to run along to YouTube. It is TSL Nigeria TV. And subscribe, and also follow us on all our socials, TSL Nigeria TV. We are gonna be here tomorrow for the weekend rundown, giving you all the crazy things that have happened during the week. I will be here, Joyce Chooks will be here, and of course Ejiro Mogade will be here. Join us next week again for another round of the Breakfast Show. Till we come again your way, same time. It is a bye for now. Good morning.